Please observe my patient. She is 36 years old. When I look at her, I notice the presence of sagginess and tiredness. Can you zoom in, please? So, as we discussed, we are going to start the marking. Chin down, eyes up. I have to mark the transition between her lower eyelid and her cheek. This is the first important aspect, and I do this both sides. After marking the junction, I turn the face. Then I have to check L2. In her case, she presents a very important projection look. So I cannot inject L2 for her. She's really already important, so we skip L2. But I have all of this lateral aspect to inject. Then I mark, we're starting with needles, okay? I mark, I feel, look, the fusion of the bone in the zygomatic arch. Then I mark 1 point, another anterior point, but away from L2, and a third posterior one. This will guarantee for me that I can improve the nasolabial fold that is prominent by lateral lifting look. Now I proceed with the injection. Turn. Look. Cleaning is very important. I ask the patient to close her eyes, then I clean. Very importantly. I get Juvederm Ultra Plus. Look. Juvederm Ultra Plus comes with 0.8. So very important is to prime. When we prime, we have to see the bubble, but we cannot touch the bubble. So I make this to improve. I clean again. Then I position my finger. I pinch the skin so that she feels less pain. I retract, look. Then I inject where the black dot was. Touch the bone, aspirate, and I inject 0.1. Remove without contaminating. I retract and I aspirate and I inject another 0.1. And on the third point, look, I retract and aspirate, inject deep. Yes? Look, I did a total of 0.3 in my syringe. So this is the first 3 points in L1. My friends, now it's very important, cotton tip. Let's see what L1 has done to her. Look at the camera. Observe that after injecting L1, there was a change in the position of the dotted line. We see changes in her eye area. Take a look at the corner of her eye. Take a look when I compare the untreated side. I also noticed that there was a change in her upper lip when I compare to the other one. Close your eyes, please. Then I will ask her to chin down, and I don't know if it's visible, but observe her nasolabial folds. Then we see, after L1, we see eyebrow lifting, take a look, indirect approach. We see she's getting a better shape. The dotted line improves. Take a look at the changes in her nasal flare and also in her upper lip. That's why L1, open your eyes, is so important in Asian patients. And you see, L1 is very posterior to L2, and this makes the patient, look at the camera please, this makes the patient look slimmer already. Take a look in her lower part. So I'm treating L1 to improve the nasolabial fold, but I also have indirect effects into the brow, the eye, and in the jawline. Now smile, 大笑. Also take a look how less lines she presents in her lower face. Look. This is why L1 is so important. 放松. Now, after injecting L1, we are going to mark L8. The position of L8, we will feel the inferior margin of the zygomatic arch. I'll ask the patient to bite for me to feel the anterior margin of the masseter. Yeah. I feel here. Then I mark the anterior. Look, 放松. Then I usually tilt to see the concavity, and I mark the inferior pattern. So L1 lifts, and L8 also helps the nasolabial folds. Look. Because of this area is bigger than L1, this area in L8 I usually use Juvederm Ultra Plus with a cannula and fanning. Let's do it. Turn. So very gently. It's very important never to touch the cannula, okay? And we have really to clean as much as possible the area. Clean neurotically because it's important to avoid infection. I get a 23 gauge needle. Look, I pinch the skin, I enter, look. When I enter, I make a round movement to open the orifice. I get the cannula, then I have my assistants to take it out. Remember that we have to inject into the subcutaneous. We have to do very gentle movements so that the patient does not suffer. So then, I start fanning in L8. Look how relaxed the patient seems to be, and also the patient seems not to feel pain. If I inject very strongly and fast, the patient will suffer and they will never want to continue the treatment with us. It's very important to be able to deliver a result that is not painful for our patients. So a total of 0.8 was injected in L8. Okay? Usually in L8, because it's fanning, we can massage to make the treatments more regular. We injected L1 and L8. Let's go and see. Sit up, please. Okay, can you see that the patient, time by time, is getting slimmer? take a look at the change in her lower face. Close your eyes. Take a look when she tilts down. You see, when she tilts down, we notice a change in her facial shape. She's becoming more oval. Also, take a look. She's getting less lines everywhere by injecting and reducing the sagginess. Now it's the time that I address L3. How to go to L3? Look, I have to ask the patient to look at me. I mark the mid-pupillary line. I feel the infraorbital foramen. And this is the area that I have to address L3. Look. So I need to put a tiny bolus of 0.3 in L3. I have a syringe, look. I have a syringe, then I have 0.5, correct? I will inject 0.3 and I will have 0.2 left for me. Okay? So now, I have here the injection sites. I have the position of the infraorbital foramen, which we cannot go with needles. I have L2, which is a no-go area. Woman, tightly, woman 不可以注射. Okay? So I have to inject between the line and the red. I will remove the marking because I don't want to tattoo. I don't want to contaminate. I remove the mark, then I will clean. Look. I put my middle finger in the foramen, my second finger in the orbit. Then I get my thumb and I lift, look. I clean. Then I get the needle, right, with 0.5. I go perpendicular, look. I deep injection, aspirate. Then I inject 0.3. Everything is protected, so I'm sure I'm delivering a very safe injection to my patient. And precisely, look, I have 0.2 left in my syringe. Is it visible? Okay. So, let's see what L3 has done to our patient. So, L3, take a look how younger and also more beautiful and defined she looks after L3. Can you zoom in her eyes, please? Take a look, the change in her eye shape and also in her nasolabial fold. Take a look the change in the position of her nasal flare. 小,大小. Okay? So now, see time by time how it lifted and also is improving with a more energetic peri and eye area. Funson? Now it's time for me to address NL1 with needle. I have 0.2 left, then I get the same syringe, and I will inject with NL2 with the patient's lying down. I tell the patient that here is a little bit painful. Tightly, tom, idien. Okay? So clean. I have 0.2 left in my syringe before. The same one that I was using, right? I get the same syringe. Look, clean. I have 0.2, right? Then, be careful, because this is an area that we have to inject deep. Look, deep. We aspirate. If we inject superficial with needle, we may have serious compromise. So, another syringe is over. So I injected already 2 syringes on her right hand side. Zoom in more. NL1 is very important because when we do with needle, besides improving the nasolabial fold directly, it also changes the position of the nasal flare. Now take a look. Time by time we are changing, and she's looking less saggy, and also she's looking smaller on the treated side. Now I'll ask her to xia. Take a look that when she smiles, we also see less widening of the nasal flare. Fanson. Now I will start with refinement on L3 as well as in nasolabial folds. L3, as we mentioned, can be addressed with needles when I have deep support. I did with Ultra Plus. And now I can also inject more medially where I have the infraorbital foramen. Look. In this area, I can get Juvederm Ultra, and I will put 0.4. Because I'm very close to the foramen, and this is the alert zone, I will fan injecting into a deeper plane. Always be careful with the foramen. So Juvederm Ultra with cannulas. Okay. Also this area, because it's close to the nose, the patient may also feel pain. And I can say, tell her very slowly, 在这里也不可以不动, okay? 一点一点. So it can be a little bit painful. Look, clean. Very important to clean. Then I pinch the skin. I get a needle, a 23 gauge needle. Enter, and I make a round movement. Then I get the cannula with 25 gauge cannula using Juvederm Ultra now. So we have to make sure that we introduce the cannula very softly and fanning. As I mentioned, this can be very painful for our patients, so we need to go very slowly. So have a syringe. Is going to be injected in L3, 0.8. Has a syringe. I will inject 0.4 only. Half a syringe. You see, the more I invest in L1, L8, and L3, observe how, time by time, she's getting slimmer and younger. Close your eyes. Take a look. When she tilts down, observe when she opens and lifts up. Eyes up, please. Yes, look up. Yes, that's it. We see, take a look. More energy in her eyes, different shape. Now let's go with smile. Take a look. More and more she is improving. Now I'm going to refinement with a cannula in NL1, NL2, NL3. I have 0.4 in my syringe. So I inject 0.2 in NL1, 0.1 in NL2, 0.1 in NL3. Getting the 23 gauge needle. So this was the question that one of the doctors asked me in Shanghai. We can inject yes with cannula into the nasolabial folds, especially if we are addressing the subcutaneous. Very gently, so 0.2 in NL1, 0.1 in NL2, and 0.1 in NL3. You see, very gently. So, finished the syringe of Juvederm Ultra, the refinement of the nasolabial fold. So first I gave a structure with Ultra Plus, deep, with the needle, then refinement with a cannula. I will remove all the marks now for us to check. Also, I don't know if it's see, take a look how she looks slimmer. So only by injecting, you see, the MD codes, they are very useful not only for direct injections, but indirect. Take a look, the eyebrow lifted, her bone looks to be smaller if I compare to the other side. Her nasolabial fold has improved, and even her jawline. Everything is indirect. Sure. Take a look how more lifted she presents, and she has less lines on the treated side. Okay? Is it clear? Visible? Now I'm going to go to the other side. I'm going to do everything again. So let's review. Close your eyes. Take a look at the lifting effect that we have. Time by time, we notice that she looks less heavy and she presents less nasolabial folds. So, really interesting is when we try to improve, we can get the direct and the indirect approach. Now let's go to the other area. How we started the marking. First, we have to mark the no-go zone. This is the no-go zone. We cannot inject in L2. Why? Because in her case, she has already a beautiful L2. Then we have to mark the zygomatic arch. When we mark the zygomatic arch, we have to feel the fusion. Mark the central point. Then we have an anterior and a posterior point. After, I ask her to yeah. Yeah. Then I mark the anterior margin. 放松. Then I tilt to see the concavity, to see where I can lift. So with this, I inject 0.1 per point, a total of 0.3. I have here 0.8 injected with a cannula because it's bigger. After this, I marked, open your eyes, her mid-pupillary line to identify the infraorbital foramen. I found the point of L3. All of this, L1, L8, and L3, they are injected with Ultraplus and to give structure and support. I also notice the importance of structure in NL1. So, a total of 2 syringes will be injected per site. One syringe in L8 and another syringe with 0.3 in L1 plus 0.3 in L3 plus 0.2 in NL1. So I have 0.8 and 0.8. After, if she still has any importance in the nasolabial fold, I started with refinement. And refinement, I marked the area of L3 and injected 0.4 of Juvenum Ultra. And finally, I went with NL1 again, NL2 in NL3 with cannula. Okay? I will do step by step. Turn, please. So remember, we have to be gentle because the products, they do not present, they don't have lidocaine. But if you look, I don't know if it's visible, the patient seems not to feel pain. This is very important. And when I'm injecting, it's very important, I cannot put the needle in the marking because it contaminates. So take a look how precisely I clean, but I don't inject in the marking. Please observe that. So get a new syringe, prime, don't touch the bubble, okay? I have 0.8, I retract the skin, look. Then I inject where the black dot was, deep injection. We do a 0.1. If it's not bleeding, I continue, look. Another 0.1. If it's not bleeding, I continue. If it bleeds, I have to stop. Look, 0.1. I ask my assistants to change the needle. I have here, look, 0.5 left, where I will inject L3 and NL1, right? So, I wait a little bit so the patient doesn't suffer. Now I will proceed with L8. L8 is a large area, so I clean. And you look, I would like you to notice that I don't touch the camera with my finger because it started sterile, but it's not sterile anymore because I'm touching all of her face. So I really am very careful to avoid contamination. So getting a 23 gauge needle, pinch the skin, enter the 23 gauge needle, right? I make a round movement to widen the orifice. Then I get Ultraplus, enter into the subcutaneous, look. sometimes the patients present retractions here. It's very difficult, but if you look at her, she looks to be sleeping. She feels no pain. I try to inject very slowly. Although Juvederm Ultra and Ultra Plus, they do not have lidocaine, you see that the injections can be very tolerable if you use proper technique. Injecting slowly. Look, the secret is to inject slowly. And I don't know if you notice, when I inject, I don't do brutal movements. This is what I would like you to do, please. When you inject, remember that the patient, they feel pain if we do very brutal. Now after, we have to lower the bed. Look, I will lower the bed to make the patient easier for me. Then I have to go to L3, right? But now I'm right-handed, so L3 can be challenging for me because I inject better for the right-hand side. So I put my thumb on the foramen, I change the fingers. Then I put my second finger to protect the eye, then I lift. I will remove the marks so that we can reduce any risk of contamination. I have the same syringe that I used, right? Look, clean the area, very precise. I get 0.5 that is in my syringe. I put my thumb in the foramen, the second finger in the orbit. Take a look how I lift the cheek to improve the nasolabial folds. Then I enter deep. I touch the bone, I aspirate, and I inject 0.3. So in my syringe, after injecting 0.3, I will stay with 0.2. Is it clear how precise I try to be, right? I try to really create very precise injections to have reproducible results. After injecting, I have to go to NL1 and inject 0.2 to end. I will take out the mark so I don't contaminate. Then clean, I use the same syringe, right? Then look, I have 0.2 left. Very careful, because this is a very important area for arteries. Then I enter, touch the bone, aspirate, and inject. So, a full syringe is over. Then I get a cotton tip, if it's bleeding, to stop. But what I want to show is that the patient seems not to feel discomfort, which for me is very important. I don't want my patient to suffer, you know? It's very important that we protect our technique, we create a very friendly technique. Sit up, please. It's good. Okay, relax this zone. Now, after injecting all of this, right? Let's proceed with L3 with Juvederm Ultra to get us the refinement phase. Look, clean, very important. Pinch the skin. Get the 23 gauge needle. Round movement, look. Enter. When I'm injecting, gauze, please, gauze. When I'm injecting L3, this is a very sensitive area because it's close to the infraorbital foramen, so the patient can really feel pain. So I go very slow. I don't want the patient to suffer. So 0.4 will be injected, fanning. I would like you to notice how gentle I try to inject without promoting any brutal movement. Look, 0.4 is gone. 你喜欢好？你喜欢好？
怎么样？感觉怎么样？
Okay, good. Then, I'm almost finished. I will proceed with refinement into the nasolabial folds. Then pinch the skin. This is sensitive area because it's close to the nose and the lips. I have 0.4 left. Oops, so stop. I have to pinch. When I pinch, he can start bleeding. Just a second. I dry, so he cleans for me. Yes, very good. Then I go. Then I start injecting very gently. Zero 2 and L1, 0 1 and L2, and 0 1 and L3. This is refinement. Gauze. Okay? Take a look. Take a look that immediately after the injection, this is why I believe this is a very great natural result that we have with Juvdem Ultra and Ultra Plus with empty codes. Take a look. Take a look, we look at her, we see no stigma of the injections. She can go now, live the clinic without any sign that she was treated. And this is what I believe the MD codes, look at the camera, the MD codes can deliver to our patients.